Healing with light, an age-old idea recently jump-started by technology. MLA believes enabling people and the medical profession to access and exchange information on this advancing science will lead to a healthier world.
Phototherapy also may be useful in certain bacterial as well as viral kinds of diseases. Activated with light in some sort of filter system like a dialysis machine, so the patient had virus like HIV circulating, they could eliminate that from the peripheral circulation.
The use of light therapy is able to prevent the buildup of inflammation in the mucosal system and saves people a lot of pain. There are some doctors who are working to use it for things like AIDS even.
I remember watching Olympics in the 60s and 70s where Russian and Czechoslovakian athletes would get injured and back the next day, and comparable injuries to other nations, they were out. So what were they doing back there overnight? Well, it turns out they were using biostimulation of cell tissue.
Light also triggers the formation of new blood vessels in an area that has been damaged. Not only that, it triggers an increase in the flow of blood through these blood vessels as well, which means that the injured tissue receives more nutrients, more oxygen, becomes more oxygenated, and as a result heals faster. You're looking at billions and billions of dollars that we could save by just doing something as simple as treating them with light, which is commonly available, which costs significantly less.
Photodynamic therapy, on the other hand, is a treatment modality. It uses a light-sensitive drug that is distributed to all tissues in the body, all of them. And next, a light of proper wavelength is shined on the diseased tissue. And the light causes the drug to create a chemical that will destroy the diseased tissue.
There have to be some good uses of light because, let's face it, the fundamental basis for all life on this planet is light. I mean, if you don't have light from the sun, you don't have life. The appeal of photodynamic therapy is, rather than using cold surgical steel to create a scar and stitches on the skin, what we're doing is we're giving a drug and then we're shining light on the skin. And psychologically, patients really prefer that. You know, there's nothing quite like having your skin incised by a scalpel blade that kind of sets people off.
Treating inflammation and treating of pneumonia and so, yeah. Blood irradiation was introduced in 1920s. Speak about fantastic results because mechanism of that is not clear, but people think that this is some kind of immunomodulation.
Quantum leaps in medical progress occurred with the development of immunization, then the discovery of antibiotics, and now healing with light. The medical industry now has the opportunity to transform into an even more powerful system of healing, enabling healthcare for all.